We're honored to be joined by Camilla Languille, CEO of Mubadala's private equity platform. Camilla leads Mubadala's global direct investments across sectors including healthcare, technology, consumer, financial services, industrials, and energy. Since joining the firm in 2013, she has been instrumental in building its healthcare portfolio, leading investments in companies such as PCI Pharma, Envirotainer, Evotech, and Norstella, and expanding Mubadala's investment teams across Abu Dhabi, New York, London, and Beijing. Before joining Mubadala, Camilla worked in M&A with Daiwa Capital and SocGen in Paris, focusing on healthcare, technology, and industrials. Earlier, she was part of the investment team at Virgin Group in London, where she helped launch Virgin Healthcare. She began her career in healthcare M&A at JPMorgan in New York and London. Camilla holds a degree in econ and political science from Columbia University. Canadian national, she's lived in 14 countries and is fluent in English and French. Camilla, thank you so much for joining us today. How are you?
Thank you, Aryan. Pleasure to be here.
Amazing. We'll just jump right into it.
Sure.
So could you take us to the start of your journey? What sort of first influenced your ambitions, and how was your time at Columbia?
First of all, my time in Colombia was great, and I am so envious that you are in university right now because I have to say I had such a fantastic experience, and I'm sure you have the same at Edinburgh. So cherish it while you have it. So going back to the beginning of my journey, I would say it really started in Colombia. I mean, I could talk about the high school years, growing up in different countries, which did have an impact on my thinking now as an adult. But I would really say the bulk of it started at Columbia University, being in the heart of New York City, having access to so many different firms and institutions, and being able to intern while I was at school made a big difference. So I had an internship, for example, at the United Nations. As you mentioned earlier, I studied economics and political science, and given that I had grown up in 14 different countries, I actually thought that my plan would be to become a diplomat. Um, so I spent some time interning there. My mother herself, had worked at UNICEF before, so I had a little bit of an inkling as to what that would look like. But I think the most important piece of that story for me was being part of an organization where you have purpose and where you want to effectuate change for the greater good. So that's probably the key lesson that I took away from my time there. And then once again, being in Colombia and in New York City gave me access to Wall Street, and I interned pretty early on at what was formerly known as Bear Stearns, has since actually been acquired by JPMorgan, but I had an internship during my time in university working on Wall Street, and that was really my introduction to finance. That set me up for my first job at JP Morgan. I was in the healthcare M&A team in New York, and eventually moved to London with JP Morgan, and then moved over to the buy side when I joined Virgin Group's direct investments team, helping them to start their healthcare franchise. Once again, in that decision, I think what really attracted me to Virgin was not only the ability to become a principal rather than an advisor, i.e., you make your own investment decisions and then you kind of live with them, all the way through to exit, which is not what you get as an experience being on the advisory side because you tend to be quite transactional. But apart from that, Virgin also had this sense of purpose, and Richard Branson was the founder, and I think he's well known in the UK, but he has some crazy ideas, but all of them are imbued with this sense of wanting to do something different, wanting to have an impact, and building businesses with a purpose. And I think that has been a key theme for me throughout my career, and that has really culminated in my work here at Mubadala. I joined Mubadala about 13 years ago. I've always been in the private equity group or the various iterations thereof of the private equity group. But again, for me, Mubadala is one of these amazing institutions where you can operate in finance, you can make investments, and do all of that with a sense of purpose, with a desire to have a positive impact on society. We don't see those two things as mutually exclusive, and that really is a wonderful place to be able to work.
You've had a great journey. I'm very envious. You've had so much experience across, New York, London, and now Abu Dhabi, obviously. Also being part of teams, sort of setting stuff up, as you mentioned. So that's really
Yes.
good. But if we go to the beginning of things, maybe it was equity research at Bear Stearns, right?
That's correct. I worked for an amazing woman named Dana Telzi, who was ranked number one equity as an equity research analyst at that time. And I think she was ranked one for several years in a row. She was focused on retail, which I found actually intellectually interesting because understanding the retail market means you have to have an understanding of the consumer.
Mhm.
And having an understanding of the consumer means you need to understand macroeconomics, understand the changing, political and societal landscape, because all of this impacts the end consumer. So I had a really great experience with her, not only because the job was intellectually interesting, but also because she was such an icon in equity research and that equity research landscape back then. And it was amazing to be able to see a senior female executive in Wall Street, do her thing.
Yeah, no, that's great. I'm sure at that time, it's like you have someone to look up to, and that mentorship it can provide can be, life-changing, I'm sure.
Yes, and she absolutely provided a lot of mentorship. She was probably one of my earlier mentors in my career, if I look back.
Okay, that's really good to know. You then went to JPMorgan for healthcare M&A, and healthcare has been such a big theme in your career. So I remember hearing you say that your father once told you that he didn't want to be older for longer, but younger for longer. Has that perspective sort of influenced how you think about healthcare, and what has sort of made you stay so connected to the field?
Yes, and longevity is such a big topic nowadays as well. So what my father said a long time ago is actually a very common theme nowadays in healthcare. Um, I think that has influenced my desire to stay in healthcare, but in general, I think healthcare is also an industry where it's easy to find purpose,
Hmm.
um, and that makes it a lot more enjoyable to come to work every day because you have this immediate link to providing a positive outcome for society. And as I mentioned before, that's been an important consideration of mine throughout my career. And so healthcare seemed a natural fit. Um, I enjoyed that work when I was at JP Morgan, working with all of these different healthcare companies, pharma companies, biotech companies primarily. And then I think what reinforced my desire to stay in the healthcare industry, at least for, a majority of my career, was my mom's own experience. She was diagnosed with late stage non-small cell lung cancer it's about 15 years ago. And I watched her go through that journey. She passed away 10 years ago,
Sorry to
unfortunately.
hear that.
But seeing her as a patient, and being, a participant, if I can call it that way, being an active participant in the healthcare ecosystem made me realize how important that sector is for us. And I feel pretty privileged to be able to work in that ecosystem even as an investor.
Yeah, no, I'm sorry to hear that. And I'm sure that, you can have an impact in such a important sector, not even being a doctor by shaping policies, but also sort of shaping the economic and commercial landscape of the place. So I'm sure that's been something that, has been really fulfilling for you.
Absolutely. The operators of hospitals, folks that are, managing pharma companies, scientists that are trying to find the next breakthrough medicine. Even insurance companies play an important role making sure that patients can pay for the treatments they get. And on the investment side, I think we play an important to ensure that capital goes to the right places in healthcare to once again ensure that we drive impact.
Yeah, no, I couldn't agree more. So you joined Mubadala in 2013, around 13 years ago. moving from Paris to Abu Dhabi at a time when the firm was expanding its global footprint. What sort of motivated that move, and what was the story behind your decision to take that new challenge on?
So when I made the decision to come to Abu Dhabi to join Mubadala back in, well, it was actually in 2012 that I made the decision. I joined in 2013. The firm at that time had about $70 billion of AUM,
Hmm.
assets under management. Today we have over $330 billion of AUM. So it just shows you the immense growth that we've had over 13 years. I couldn't have predicted, to be honest, how fast we would grow and how rapidly we would become an international institution.
Hmm.
Back then, it was really a MENA-focused development company, but I was really excited by the vision that my executive director, former CEO of the private equity platform had for the business, and also what our group CEO, Khaldun Al Mubarak, had for the overall firm. There was so much white space to grow. They had such a clear vision of, at that point in time, we were always discussing a dual returns, financial returns, but also social returns. And so that part was highly motivating for someone like me who wants to do investments, wants to be in finance, but wants to do all of that with a sense of purpose.
Hmm. Yeah, no, I again couldn't agree more. I think it is possible. People always think, oh, to make returns, you need to be in an industry which is characterized by lack of morals or amoral. But I think it's possible to have that positive social impact, but also in return for your shareholders.
I agreed. If anything, we need more people who think that way in finance, who think about the greater good, as well as making a return. Because what I always tell my team is, um, making a return is the ticket to the game.
Hmm.
Can't make a return, you can't play the game because the game requires you to make some kind of financial return.
Hmm.
But how you play the game is entirely up to you. And there are, let's say, good ways to play the game, and less good ways to play the game. And if you get the ticket to the game, you can actually play the game in such a way that it drives multi-generational positive impact beyond just yourself, your immediate family, your generation. And that's what interests me at the end of the day about what we do in Mubadala.
No, I keep saying about identity, can't agree more because I think it also influences other firms. If they see your capital flowing towards that field, also incentivizes them. It creates that, I think, a feedback loop of sorts where, a certain industry can grow simply because of, a leading, platform with a huge AUM as Mubadala does to sort of do the same thing. And I think that's what causes widespread positive social impact beyond
I
just,
hope so. That's what I like to think at least.
I hope so too. When you sort of think of or reflect on your first years at Mubadala, are there any moments or experiences that sort of stand out to you as found yourself sort of establishing the firm's approach to investing in healthcare?
Yes, so when I first joined, I didn't work in healthcare at all. I actually ended up working in other parts of our investments
Hmm.
group. At that time, I was in utilities, I worked in mining, so everything that was very much the antithesis to healthcare. But one observation I made at that point in time was we were underinvested in healthcare internationally for a sovereign wealth fund of our scale. Don't get me wrong, we had an existing healthcare team at that time, but the Mubadala healthcare team's focus was primarily on UAE or MENA investments with a clear mandate to improve the quality of healthcare delivery here in the country and in the surrounding region. So, as such, that team, entered into a lot of JVs with the likes of LabCorp to set up our national reference laboratory company here in the UAE. They worked with Cleveland Clinic to set up Cleveland Clinic Abu Dhabi, which is now one of the leading tertiary hospitals in the region. They worked with, hey Ariane, it cut off for a little
Yeah.
bit. I
No, I
froze.
think I think you're fine now. Yes, I think you were talking about Cleveland Clinic. I think when we
Yes,
lost.
yes. I was talking about what our Mubadala healthcare team was doing at that stage, which was effectively building the healthcare provision network that we now have here.
Mhm.
So our healthcare team was focused on improving the quality of healthcare delivery here
Mhm.
in the UAE and in the broader region. So they set up a number of JVs with the likes of LabCorp to set up our National Reference Laboratory, Cleveland Clinic to set up our tertiary hospital, which is now one of the leading tertiary hospitals in the region,
Mhm.
Imperial College of London to set up our diabetes center, just to name a few assets. But they did amazing work over the past decade and a half to build this healthcare infrastructure that we now have in the UAE. And it's been an important piece of the puzzle for us here in the Emirates because it really allowed us to create a healthcare provision infrastructure to attract talent. When you're a country like ours where there is significant expatriate talent and you want to attract the best of the best, you need to have two things, an excellent education system and an excellent healthcare infrastructure system. So they did an amazing job doing that. But we had effectively zero international healthcare investments back in 2013. So it took us time to build the strategy to invest internationally. And in 2017, we got the mandate to do that, and I led that initiative for us in our private equity group, and made our first investment in, I still remember this, September 2017 with Lonza Group, which is the leading biologics uh, manufacturer for pharma companies based in Switzerland. And since then, we've grown the portfolio to almost to $10 billion today.
Well, it's amazing. And it's also, again, really nice to hear about how like you've seen the deeper social impact it has. Again, it influences people's lives at every level. So it's nice that there's like a section for everything. It's really nice to hear. When you're sort of looking at potential investments, what is your decision-making process like? Do you sort of have your own, or is it more of a team thing? Could you walk us through that, please?
So we have, maybe I'll take a step back and explain how we're organized. So in private equity today, we manage about $70 billion of AUM, and we operate through six global sector teams. Healthcare is one of them, but we also have, sector teams in tech, consumer, financial services, industrial and business services, and energy transition, which you named earlier. So those are our six global sector teams. We also have, in addition, four country teams focused in Asia, China, India, Japan, and Korea. Our folks are on the ground in North America with our New York office and in Asia with our Beijing office. And then we have a large group of investment professionals here in Abu Dhabi as well. But we all spend a great amount of time, frankly, traveling in the air because we need to be close to our respective markets.
Mhm.
How do we make investment decisions? Well, it really starts with the team. The team identifies the areas of the market that they want to play in. So from a strategy perspective, we always have a clear view as to where in the industry we want to invest. And some of the considerations we have in mind include, parts of the industry with long-term structural tailwinds. So there's, this long-term impetus for growth. We look for companies that are, either market leaders or in the top two, three, four, five, let's say, of their peer set. We look for management teams that are strong, because at the end of the day, you can have a wonderful business, but you really need people to drive it. And so identifying the right management team and ensuring that we have the right talent to execute in the companies we invest in is crucial. And then, of course, the team does a tremendous amount of work underwriting the deal, which means we have to go through a pretty prolonged diligence process. Most of the time, I would say the companies we invest in are companies that our teams have been following for 6 months, 12 months, sometimes years. So they know the business very well, they know the industry very well, and have a clear idea of what the value creation plan will be. And that would be the last piece of the puzzle. I would say, whenever we make an investment, we want to make sure that there's a path for us to create value. And I don't only mean for us as a shareholder, but really through the company, because we believe that if the company, can offer, greater things to their customers or help solve problems, help solve unmet needs, they will perform financially, and that financial performance will translate into returns for us as a shareholder.
So would you say it's both the science and art, science and how you view an industry, how you do the numbers, and the art and the intuition, gauging how management team is?
100%. 100%. The teams can do a ton of analysis, a lot of diligence. We run our models, and we can go through the diligence as comprehensively as possible. But at the end of the day, you also need some level of judgment and intuition to make a good deal happen. And a lot of that will have to do, for example, with the people you have, not only making the investment, but the people on the inside of the company, the quality of the management team, the quality of the partners that we make the investment with. A lot of that is very hard to quantify in numbers, and to put maths around, but that's really where judgment and intuition come in.
If we move to private markets as a whole now, what sort of changes have stood out to you over the past 2 decades, and how do you see those shifts sort of shaping the landscape in the Middle Eastern region?
Oh gosh, well, there's been a lot of changes in particular over the past 5 years. I would say where we are right now in the market cycle is characterized by three big themes. So the first theme is around macroeconomic considerations. If you think about it, we've had a pretty healthy bull run for almost 12 years that characterized most of the 2010s. We had very low interest rates, open supply chains, you know, plentiful labor. It was a good time to be in private equity, and actually growth equity and ventures as well. It was a good time to invest because you had all of these tailwinds working in your favor with low interest rates. COVID actually exacerbated that because it meant that there was a flood of money coming into the system. And then that all came. And sorry, Ariane, you froze for just 1 second. It looks like it's coming back. And now we're in a different period. We clearly have had higher interest rates. And I think just financially speaking, it's been harder to rely on rising multiples to make your underwriting case. And so that also means that we're back to good old hard value creation. You can't rely on rising prices to make your investment case. You have to really drive value creation in the company. So that's one set of considerations on the macro side. The second set of considerations is geopolitical. For the first time in, pretty much since Bretton Woods, we have deglobalization happening in earnest, and I would say a decoupling between the US and China. And so that has had repercussions, I think, globally. And the more recent examples of tariff wars, et cetera, are just, I would say a symptom of that. But that is changing the way we invest because nowadays you have to take into account some of these geopolitical considerations when you underwrite a new investment. And in terms of the existing companies in your portfolio, you have to be a lot more aware of, some of these considerations to be able to help management navigate international waters a lot more smoothly. Then I would say the third big theme is AI. We are I think in this very exciting new era where AI is just starting to take off. And it's because we finally have all the ingredients to make that possible when it comes to compute power, with semiconductors, the ability to amass data centers that can house them. So all of these other technological innovations had to happen in advance for us to be able to have AI, but it's now here. And so we have, I think, we have to think really long and hard about those implications for any investments we make.
That's actually great you mentioned AI because that was my next question. It was about how AI is sort of shaping healthcare in both ways. It's delivered, but also on how companies operate. Have you been able to sort of get, a vantage point on that?
Yes, and I would say that's one of the reasons why it's super exciting to be in Abu Dhabi right now, because Abu Dhabi is really converging two major industries, which is healthcare and advanced tech, as we're trying to establish ourselves as a leading hub for both areas. Um, Across the Mubadala ecosystem, for example, we have in Mubadala partnered with G42, which is the UAE's flagship AI company, to create M42, which is a tech-enabled healthcare company that uses AI to enhance research, diagnostics, and treatment across the entire patient life cycle and across all of its assets. So,
Right.
for example, through the Emirati Genome Program, M42 has sequenced over 800,000 UAE nationals. And that data is used to identify genetic risks, enable more personalized care, and it's actually the largest biobank in the world. I think the UK's genome program was around 500,000. So this is the biggest sequencing program in the world to date by a significant margin. Apart from M42, Mubadala last year was a founding partner in an MGX, which is the world's first investment fund of scale that focuses entirely on investing in the AI ecosystem, whether it's foundational models, AI infrastructure, and leading edge semiconductors. So we have, I would say, a lot of connectivity to healthcare plus, advanced tech through our ecosystem. Now, your question was around how we see AI, interacting with healthcare, and we're already seeing how it's driving a lot of use cases across different sectors. So, for example, in pharma and pharma services, AI is beginning to improve R&D efficiencies through generative design, virtual clinical trial simulation, and early predictive manufacturing. When it comes to early stage drug discovery, we have one asset called Evotech, which applies AI extensively through platforms to identify new drug targets and predict safety and toxicity and reduce the failure rates of these molecules that they're eventually trying to get into the clinic. In healthcare tech, there are a lot of use
Mhm.
cases for AI. We see it in terms of documentation. AI is also, helping decrease the work for doctors and nurses when it comes to documenting diagnosis and treatments. On the payer side, we see AI helping with payment integrity. We have one asset called Zealous, which is powering real-time dashboards. They're automating claims analysis. They're enhancing payment accuracy and repricing for issuers. Repricing for insurers rather, and they help payers identify savings. So they're helping reduce the costs of healthcare to the overall system, and AI is playing a big role in doing that.
So it's clearly a big opportunity, and one of the biggest opportunities that I've come across actually in an article you wrote for the WEF was women's health. You mentioned it was $1 trillion opportunity that's still seen as a niche, unfortunately. Why do you think it's taken so long for investors to see its true potential, and what do you think it's gonna cause that perception to change?
Well, I think there's a lot more. I think the good news is there's a lot more discussion around it today than there has ever been around women's health historically. Um, I still believe that gender gap represents a $1 trillion opportunity. I think, if you haven't looked into it yet, that McKinsey World Economic Forum report around those numbers it's a really interesting read to spend time on to get more data around it. But I would say to your question as to why it hasn't gotten a lot of let's say, press or focus or interest, I think women are not speaking up. So the first step would be for us to say a little bit more about it. I mean, we do make just under 50% of the global population, and yet, women's health receives just, and this is at the very upper end of estimates,
Mhm.
5% of global healthcare R&D spending. Some say it's closer to 2, which is abysmal, but
Mhm.
it has a very low share of, let's say, the economic pie when it
Mhm.
comes to healthcare spending. Um, I think, the view that it's a niche area is an outdated perception. We still need to do a lot of work to change that, but that outdated perception has really historically restricted capital allocation to women's health. Our team did a lot of work examining, all of the healthcare deals done in what would be classified as women's health in the past, I think the past 7, 8 years. And we've seen that actually these investments have returned on average 2 times their capital, which is squarely in line with, buyout targets when it comes to return targets. And so you can invest in women's health and
Mhm.
make a good return. And on top of that, you're really driving an important initiative to help close this gap in women's health. So it's a win-win if
Mhm.
you're an investor.
Yeah, no, I agree a lot with that. And I think one of the things, as you mentioned, is that it's like a self-perpetuating cycle where the perception, which as you mentioned is outdated, keeps feeding like what people do. So I think once that perception breaks, there'll be fresh ideas, and I think that's something that again people need to speak out. Women need to speak out more. So that too,
Mm.
if it is two, that is as you said, abysmal. Well, that 5% becomes 40 to 50% because I think again, as you mentioned, 50% of the population. So it's only fair if it's 50% of R&D spending, right? If not more.
Yes, indeed. 100% agree.
What does progress look like for you in this domain then within the next 10 to 15 years where like you're like, okay, I wrote that article around 10 years ago and now I feel like someone actually listened and someone actually effectuated it.
I would love to see more investment go into women's health. And I don't only mean from investors like ourselves in Mubadala.
Mhm.
We're a large scale sovereign investor in private equity. We do focus mainly on buyouts and late
Mhm.
stage growth equity deals, meaning that we focus on more mature businesses. Um, the issue we have being, let's say mature company investor, we don't have enough of a pipeline
Mm.
of mature women's health companies to invest in. We are looking at it through a growth equity lens, but it's late stage growth equity. So we really need more venture capital and early stage capital to go into early stage growth equity capital to go into this market. And that pipeline is a little bit broken. Now, beyond investors like ourselves, investors in venture capital, growth equity, allocating capital to this space, we also need, more research dollars to go into women's health to begin with, because research dollars effectively, set the stage for a 10, 20-year horizon of women's health innovation. Putting more money into research allows, R&D companies, biotech companies to create drugs that address women's health in particular, allows diagnostics players to create the right diagnostics tools to be able to determine women's health issues earlier. So that's another piece of the puzzle that needs to be in place. And then lastly, I think governments and regulators can do a lot to ensure that more focus and eventually more capital go into this arena. But all of those three players in the ecosystem need to work closely together.
Yeah, I think we have a lot, to look forward to, and collaboration, as you just mentioned, is the key. Just to end with Camilla, it's been really nice talking to you, but one question we always ask our guests on the channel is across your career, across your journey, what has been the most fulfilling and rewarding, part of it, would you say for yourself?
I think the most rewarding part of it is building teams and building companies. And they're kind of one and the same thing, insofar as it has everything to do with working with people. I found it extremely fulfilling to have built the healthcare team from ground up. And that meant, uh, attracting talent, hiring in that group of people. It was about 20, 25 people altogether, and coaching and developing them, really helping them to succeed. Now, I no longer run the healthcare team. It's my colleague Mina Hamoudi, who is fabulous in so many ways, and I'm so thrilled to have been part of her journey in as small a way as I could have. Because now she's just taking off and taking that healthcare team and that healthcare mandate to an entirely new level. And I'm really proud to see her do that. And then when it comes to companies, it's working with management teams and really seeing them succeed with our support, and being able to play a small role in their success is also incredibly fulfilling. But it goes back to working with people, seeing other people succeed, and playing some kind of role in that. I think it's probably the most satisfying part of my journey so far.
That's amazing. And I love how emphasized it is on people. At the end of the day, that is what drives everything, right? And always comes back to that.
Yes, and I think we always underestimate the change we can make, the impact we can make. And if there's one key takeaway I would want to
Mhm.
impart to folks like yourself,
Mhm.
in third year of university, your other peers, there are a lot of challenges right now, globally, when it comes to the macroeconomic outlook, geopolitics. And I get the sense, speaking with a number of younger folks, actually also speaking with my own peers in their 40s and 50s, that there's a bit of this, you know, disheartened view, of what the future will bring. This is I would say, a cultural slash mindset shift, that has happened slowly over the past generation. And I would say that it's really important to have hope, and to not to underestimate the impact you can have personally, as a group, as a generation. There's so much change that you can effectuate, and don't underestimate your power to do that, because folks like myself, we are coming up to this point in our career where we're senior executives, but we're really relying on the next generation to point all of us in the right direction. So I have a lot of belief in your generation, what you can do, the positive impact you can drive, and don't ever forget that when you're thinking about what's next for you.
Yeah, no, I love that. And that optimism and hope is ultimately what, again, you can't do anything without that. So really appreciate you saying that. And again, I really love all the insights you've shared. So thank you so much for the time. It's been lovely talking to you.
Thank you for having me, Aryan. It's been a privilege. Thank you so much.
Thank you.